Hey everyone, and welcome back to the channel. If you have Crohn's disease or ulcerative colitis, you've probably heard of Infliximab. It's one of the most commonly prescribed biologic treatments for IBD. But how does it actually work? What happens inside your body when you receive an infusion? And why do some people feel sick afterward? Infliximab is a powerful treatment, but it's not without risks. In today's video, we're going to break it all down: how it works, how much you receive, side effects, risks, and even how much it costs. Since its FDA approval in 1998, over 2 million patients worldwide have been treated with Infliximab, making it one of the most extensively studied biologics, with more than 2 decades of clinical data and real-world evidence to examine. This is information that many doctors don't fully explain, so if you're thinking about starting Infliximab, or you're already on it, this video is for you. Studies show that patients who understand their medications have up to 30% better adherence rates and significantly improved clinical outcomes, highlighting why this knowledge matters for your treatment journey. Let's dive in. Let's start with the basics. What exactly is Infliximab? Infliximab is a biologic medication, meaning it's made from living cells rather than being chemically synthesized like traditional drugs. It belongs to a class of drugs called TNF-alpha inhibitors, which target inflammation in the body. It was originally developed for rheumatoid arthritis, but doctors quickly realized it could also be used to treat inflammatory bowel disease, IBD, including Crohn's disease and ulcerative colitis. First approved for Crohn's disease in 1998 and for ulcerative colitis in 2005, Infliximab was the first biologic therapy to transform IBD treatment, establishing an entirely new paradigm for managing these challenging conditions. When you have IBD, your immune system overreacts and attacks your own digestive tract, causing chronic inflammation. Infliximab helps stop this process by targeting a key inflammatory protein, tumor necrosis factor alpha, TNF-alpha. Clinical trials show that Infliximab can induce clinical remission in approximately 40 to 60% of patients with moderate to severe IBD who haven't responded adequately to conventional treatments, making it a crucial option in the therapeutic arsenal. Infliximab doesn't work like a painkiller. It doesn't just mask symptoms. Instead, it modifies the way your immune system works. So, what happens when you receive an infusion? Infliximab is given intravenously, IV, meaning it goes directly into your bloodstream. The infusion takes about 2 to 4 hours. A nurse will monitor you closely to watch for any allergic reactions. Because it's a biologic drug, it must be given through an IV. It can't be taken as a pill because your digestive system would break it down before it could work. Once Infliximab is in your bloodstream, it seeks out TNF-alpha and binds to it, preventing it from triggering inflammation. It's like turning off an alarm that's been blaring for no reason. Your immune system stops attacking your intestines. Over the next days to weeks, inflammation decreases. Symptoms like diarrhea, abdominal pain, and fatigue start to improve. Some people feel relief after just one infusion, while others take a few treatments to notice changes. But here's the catch: Infliximab isn't a cure. Most people need ongoing infusions to keep their symptoms under control. One of the most common questions is, how much Infliximab do I actually get? Dosing schedule: first dose, week 0, second dose, week 2, third dose, week 6, maintenance doses, every 6 to 8 weeks. The dose is based on your body weight. The standard is 5 milligrams per kilogram of body weight, but some people need a higher dose if their body processes the drug quickly. For example, a 70-kilogram person would typically receive 350 milligrams per infusion, though research indicates that up to 30% of patients eventually require dose intensification to 10 milligrams per kilogram to maintain clinical response. Some doctors use blood tests to measure how much Infliximab is in your system. If your levels are too low, they might increase your dose or shorten the time between infusions. If your body is making antibodies against Infliximab, the medication might stop working. Studies show that proactive therapeutic drug monitoring can reduce treatment failure rates by up to 40% compared to symptom-based dosing adjustments, as it allows for personalized dosing before symptoms return. Like all medications, Infliximab has side effects. Some people tolerate it well, while others experience more issues. Fatigue headaches, nausea, joint pain, skin rashes. Your immune system is weakened, increasing your risk of pneumonia and other infections. Some people experience fever, chills, or itching, rare but possible. If you have severe side effects, always talk to your doctor. A lot of people report feeling sick or extremely tired after an infusion. But why? Your body is learning to function differently. Your immune system might temporarily overreact, making you feel flu-like. The infusion process itself can leave you feeling drained. Infliximab is considered safe for most people, but it comes with some risks. Increased risk of infections, possible higher chance of certain cancers, very rare, loss of effectiveness over time. Because of these risks, doctors monitor patients closely with regular blood tests and screenings. Large-scale registry studies tracking over 190,000 IBD patients on biologics have shown that while infection risk is approximately 2 to 3 times higher compared to non-biologic therapies, the absolute risk remains relatively low at about 4.4 infections per 100 patient years. This risk must be weighed against the significant benefits of disease control and the potential complications of uncontrolled inflammation. Most serious infections occur within the first 6 months of treatment, which is why tuberculosis screening, vaccination updates, and vigilant monitoring are particularly important during the induction phase. A comprehensive meta-analysis of 22 clinical trials found that proper pre-treatment screening can reduce serious infection complications by up to 70%. Infliximab was first approved by the FDA in 1998, making it one of the oldest biologic treatments for IBD. Here's the shocking part. Without insurance, Infliximab can cost anywhere from $1,500 to $5,000 per infusion. That adds up to tens of thousands of dollars per year. A full year of maintenance therapy typically ranges from $24,000 to $50,000 annually, making it one of the highest-cost chronic medications on the market. Luckily, many insurance plans cover Infliximab, and there are patient assistance programs available. Studies show that approximately 80% of patients qualify for some form of financial assistance, with manufacturer programs often covering up to 100% of costs for eligible patients with demonstrated financial need. So, is Infliximab the right choice for you? It can be a life-changing treatment, but it's important to understand how it works, the risks, and what to expect. Clinical data shows that approximately 65% of Crohn's patients and 55% of ulcerative colitis patients achieve clinical response within 8 weeks of starting treatment, making it one of the most effective options for moderate to severe IBD that hasn't responded to conventional therapies. If you're on Infliximab, let me know in the comments. How has it affected you? Has it helped put your IBD in remission? Did you experience any side effects? Your experiences could help others who are just starting their treatment journey. And if you found this video helpful, don't forget to like and subscribe for more IBD-related content. Click the notification bell to stay updated on our weekly videos, covering everything from treatments and diet tips to lifestyle strategies for living your best life with IBD. See you next time.